taking time for your health. The African American Wellness Watch. Trusted information for us, by us. Dr. Mike Lenore and other experts from around the country and around the world have the latest on how you and your family can get healthy and stay well. It's time for the African American Wellness Watch. Welcome to the Wellness Watch. I'm your moderator, George Strait. We're blessed on the Wellness Watch to be able to bring to you true experts on any of the topics that we are presenting. And today is a great example of that. We're talking about how to keep your skin, black skin, and hair, black hair, healthy and well. We've absolutely got the perfect person to lead us through this discussion. I'm talking about Dr. Melanie Macklin. She's a famed researcher, she's a dermatologist, she's a good friend, and the perfect person to talk about this. Dr. Mack, thanks for joining us.
Thank you, George, for having me so that I can hopefully help your audience get some great wellness tips. That's what I love to do. So let's enjoy.
So let's start the segment then and talk about some problems. I'll call them blotches, bumps, and zits. Mm-hmm. Let's start with razor bumps. Okay. Do they still sell Magic Shave and stuff like that?
You know, they sell Magic Shave plus a whole bunch of other wonderful products out there for razor bumps because they know actually how common that issue is, especially in men of color. And also women can get a few little areas of razor bumps as well. The bottom line is that the hair, we have naturally curly, fairly coarse hair that's on our face. And when that hair grows out, it curls back over and re-pierces the skin. And that's how the bump appears. And then more skin grows over that existing bump. And so now we have a lovely bump where you can actually see the curled over hair in that area. So the key is this: some guys, if they do get razor bumps, they're going to have to, if they shave every day, George, because as soon as that 5 o'clock shadow sets in, that means that the hair has grown above the skin, and now it's going to continue to grow and have the capability of it growing and re-piercing that skin again. So we either are going to shave every day, or we're not going to shave at all if we know we have the likelihood of getting razor bumps. And in today's time, a lot of guys, they want to grow, they keep growing the beards and so forth, so they alleviate even having to deal with that issue. But there's a lot of different treatments out there. Mm-hmm. If a guy has existing razor bumps, we've already talked about how to reduce their risk. But if they have existing bumps, a lot of the same product and ingredients that we use for basic acne, we use those for razor bumps as well. So these kind of things can be purchased over the counter. There's products that have benzoyl peroxide cream in there, and that helps to not only reduce the bacteria in the area, but it actually helps to dry up some of the bump as well. There are products in there that have salicylic acid. Now that looks like an orange liquid, and you can see that in any part of the acne products at your stores. But that has salicylic acid, which helps to remove a lot of the old dead skin, George. That's where the follicle is and the bump is in the first place. So the more a guy can keep his skin exfoliated, meaning reducing a lot of that old dead skin, he's going to reduce his risk for getting razor bumps as well as being able to treat it as well.
And what about the whole idea of using an electric razor instead of a regular razor?
Honestly, a lot of that is just different marketing and different ways that a guy prefers to shave. But the physiology is still there, George. If the hair is growing above the skin and it's already coarse and hard, and it has a propensity to curl back over and re-pierce the skin, I don't care if you use a knife, a razor blade, electric, whatever. If the hair is growing above the skin, George, we're going to get the bump, and we're not going to like the bump. So we're going to either shave every day or not shave at all.
I've got two grandsons who are just beginning this whole process. They think it's cool to shave now, and I said, just wait a few years.
Yeah, but you know what, George? Honestly, guys that have followed my tips as far as the razor bumps, they keep smooth skin. They really do. Because if you understand how it starts in the first place, then you're gonna keep following that routine, and then you're gonna reduce your risk from getting bumps at all. My husband doesn't have one razor bump. He listens to me.
Exactly. So let's talk about something else. Something I've been reading about called melasma, which are these hyperpigmentation. Yeah. Talk a little bit about that.
Yeah, they're like, one of the terms we use is mask of pregnancy because it commonly occurs in women, and it's hormonal based. There's a genetic component. Also, the ultraviolet rays can exacerbate the areas, but they look like little splotchy patches that occur on both sides of the face, and they can get exacerbated by the sunlight. And it's tough to kind of treat the melasma because you're dealing with battling the up and down of the hormones that's exacerbating it. You're dealing with the sun rays, but there's a lot of different bleaching agents. Of course, I would suggest still going to your board certified dermatologist who can evaluate the different cosmetic treatments, because what you don't want to happen is you lighten up some of those areas that are dark and then they become too light and then you're still looking speckled. So put it in the hands of a professional to be able to better guide you on if you should should use chemical peels. There's microdermabrasion, George. There's lasers. There's a whole host of different types of cosmetic treatments that we can do for melasma. And there can be improvement with time and with proper treatment.
So is it more with women than it is with men? And as it begins, how does one recognize that this really is melasma, not something else?
Well, of course, you definitely bring up a good point, because there's a whole variety of hyperpigmentation, which means it's darker than your normal skin color, sort of skin issues that can occur. So of course, you really want to make sure that you're getting the proper clinical diagnosis there. But it typically, when you see the symmetrical on both cheeks, the dark splotches, the first thing that comes to mind would be that melasma. Yes. And it typically, happens in us of color, of dark complexion skin. But definitely getting to your dermatologist to have a full evaluation to make sure that's really what's going on, because there's other conditions such as lupus, which can occur in our of color community, that can give a similar, what we call a butterfly rash, and have, but of course that typically has a redder look than the melasma. Melasma is going to have more of a darker discoloration there.
So let's talk about a more serious kind of discoloration. That's vitiligo.
Yes.
I know when I first started studying this, I thought, well, most of the people that you see with vitiligo are African Americans. But in fact, African Americans don't get vitiligo any more frequently than anybody else. It's just that it's more apparent in us. So if you could talk a little bit about it, what it is, and I understand there's some new treatments for it.
Yes, well, vitiligo is where the melanocytes are pigment producing cells that occur in all of the areas of our body where the follicles are. Well, they can stop working, which means we're not producing melanin any longer. And so that's hence the term vitiligo. So it can be in localized areas, or it can be generalized all over the body. And to your point, George, yes, we recognize it more in our of color communities, but it actually is more prevalent in non-Hispanic Caucasian community. It's just, not as, it blends in more, if you will. But, it can once again occur in a localized fashion to a generalized sort of deal. As far as the treatments are concerned, first and foremost, you make sure that you have a proper clinical diagnosis with that. And that's where we take a biopsy, look at a microscope to confirm that is indeed vitiligo and not some sort of other depigmentation sort of disorder. As far as treatments, it just depends, it really just depends on if it's local or generalized. Some folks that have it all in a generalized fashion, a lot of the body is affected. They may opt to just get the whole body dyspigmented. I mean, there's, pills that you can take that will just wipe out all the pigment in the body. Of course, that really makes you more prone to sunburn and skin cancer when you do that in that sort of capacity. But localized, we have steroid treatments. Sometimes we can use like the ultraviolet radiation. There's a lot of combination sort of therapies that are used. But more importantly, getting a proper diagnosis by your board certified dermatologist, and then being able to allow them to discuss with you the different options, and know that there may be times where the vitiligo just may actually improve, George, on its own. For example, we know that there's a common association with folks that have vitamin B12 deficiency, for example, that can cause a vitiligo, whatever. And then once that B12 deficiency has improved, the pigmentation, the melanocytes can start working again to produce that melanin. So you have to really zone in on trying as best as you can to figure out what may be that underlying reason, and then zone in on that as far as what the treatment would be.
So does anybody really know what causes it? And is it genetic? Is it passed on? Do you know?
I mean, we say genetic, we say autoimmune associated, folks that have underlying thyroid issues or lupus or rheumatoid arthritis. It's not set in stone as to say, okay, this is the exact reason. So in those sort of situations, we say there's many factors that can cause the underlying issue. And so sometimes it's challenging to figure out exactly why, and you just have to get to a professional that can really understand. And there's experts that that's all that they do is focus on vitiligo. I know one of my colleagues, Dr. Pearl Grimes, who's out of the California area, that's one of her areas of expertise, especially in us of color.
And is there any evidence that it's genetic?
Yes, once again, I'm not the actual vitiligo expert. I know there's so many evolving therapies and so many evolving research, but I do know that there's constant and ongoing evaluation as to really underlying cause of vitiligo. It's one of those highly, just not sure, and I think that that's okay to say, because with medicine, everything is always evolving.
I didn't mean to put you on the spot.
No, that's fine, but that's why we need folks that have those niche sort of interests. Just like my interest is everything all about hair and alopecia. There's some people that are in my field of dermatology, they could care less about hair. They'll say, just have them to call Mac. But so there are certain areas such as vitiligo where people, some of my colleagues, that's all that they want to talk about is vitiligo. And we need people that can zone in on some of these unusual sort of skin dermatoses where we still need ongoing research to figure out exactly what's going on for better therapy.
So I guess the bottom line is, if you have vitiligo or think you do, what you need to do is find someone who is expert in just
Absolutely.
that.
Yes, I think, that's the absolute take-home point with that. I mean, most of my colleagues, we can treat tons of different type of skin dermatoses, but when it comes to something specific like that, where we really don't know why, it is better to go find a specialist within the field of dermatology that's what they focus on. And that's how I mentioned Dr. Pearl Grimes out of LA area.
So one more topic, and that's keloids. It seems as though, from the reading that I've done, that African Americans are more susceptible to keloids after they get a cut or an abrasion. I know my oldest son is.
Okay, he's keloid prone.
He gets a raised area. Talk about them.
Okay.
How it happens and what you do.
Yes, and so let's differentiate keloid versus hypertrophic scar. Hypertrophic scar is where in that area of injury, you just may get a raised area, but it stays localized to that scar. What differentiates that from a keloid is that, it may not happen right away in that scar area. It may slowly become a raised area, but then it's going to expand outside of that scar. So that's the difference. And you mentioned your son gets a scar in the scar almost immediately. He may not be necessarily in the keloid category. He may be more in the hypertrophic scar category, because typically they can get better with time. Typically, is within a year, you might not even notice that it's there. Versus a keloid, it's not going to go away. It does not fade or go away. It's not contagious. It's not cancerous, but it can expand past those borders of the scar. And that's what makes it where, people really need, they desire to seek some sort of cosmetic treatments. There's like silicone patches that can be put over scars immediately. Because basically what a keloid is excessive collagen that's produced in that scar area. And yes, us of color are more prone to getting the keloid. You'll probably see it in some women that, or anyone that get their ears pierced, and there's
Oh,
wonderful growth that's on the back part of their ear, and
mm.
and that's usually one of the first ways that people know that they keloid.
This has been a great conversation, as I knew that it would. Blotches, bumps, and zits.
Yes,
So,
some of our favorite topics, right?
but look, this is really important information. These are all issues that all of us face,
Yeah.
especially African Americans, and you've given us a way forward in all of them. And again, I thank you so much.
Yes, no, thank you, George, for having me. Hopefully, if anyone has any other questions, they can certainly email me through my website, which I'm sure you can share that information.
And I think I'll share it right now. You can get Dr. Mack's information from her website. I think you can take a look at the website URL right now, and also you can her website links to ours, which is aawellnessproject.org. aawellnessproject.org. Again, Dr. Mack, thanks a lot for being with us, and thank you for watching.